Welcome to PD Nursing Corner channel. So today I'm really excited to share the remaining part of bandages. So in this session we'll be covering on the bandages of how we are going to do on the extremities, fingers and so on. So coming to the first type of bandage, hand and wrist bandage. This bandage is mainly done for a patient who is having any injury to the hand, or might be in case of any topical application, or might be a compression bandage. So here we are going to use a technique which is called as figure of 8 bandage, which we'll be seeing in the practical session in the further classes. And then here as a nurse we have to keep in mind that this bandage will be taken a turns of 2 to 3 inches bandage must be chosen, and then see that the dressing is intact in such a way it's not going to be too tight or too loose. Thereby it is going to do the proper purpose, it is going to serve the purpose for hand bandage. So when you take finger bandage, here we are asking the client to place the hand on a pronated position, might be very straight, okay, and then whichever finger is being injured, that finger alone is being located, and you have to see that you're going to take it in 2 to 3 circular turns, and then you start the bandaging. So the size and the width, as we already discussed, it should be 2.5 width and 3 meters length. So with that, we will be doing the bandages. So as a nurse, we have to think that this bandage must be taken obliquely, that is in a very slanting manner, starting from the order of the little finger side. For example, if the patient is having injury to the index finger as well as the middle finger, then we have to start in from the middle finger and then the index finger. So it's in the turn of like starting from the little finger side, and then one spiral is being taken to the base of the fingernail and then cover the finger with several spiral turns. See that you are securing the bandage in either by a safety pin or might be an adhesive tape. So the next bandage type of bandage is such that thumb spica bandage. So in order to do this, you are going to ask the patient to have again in pronated position. Encircle the thumb 2 straight turns, lower border of the bandage in level with the root of the nail. And of course, whenever you do the bandaging, there is a small amount of or a minimal amount of the fingers might be exposed or might be the toes are exposed unless it is contraindicated. Then carry over the bandage with of several turns and repeat the bandage with the figure of 8 around the thumb and just complete the full wrist. So this we call it as thumb spica. Coming to on the discussion part of ankle and foot bandage. In this bandage, mainly we are going to make the patient for the normal positioning and alignment. So in case of an ankle and foot bandage, see that it should be kept in 90-degree angle, so there is no foot drop in order to prevent the complication. So if the patient foot is being flexed or dorsiflexed or might be hyper extended, that can cause foot drop. So see to that whenever you do the bandaging, perform the bandaging, it should be in a 90-degree angle. Wrap the limb from the distal to proximal direction, always from the lower part to the upper part. Hold the elastic compression bandage with the dominant hand and the roll facing upward and use the other hand so that you can do the wrapping of the full foot, and see that it should not be too tight or too loose in order to maintain the. So before you apply the ankle or foot bandage, it is mandatory that you have to do the that is the neurovascular assessment to know how far is the toes as well as the lower extremity functioning. So always see that how is the circulation just by checking the color of the distal extremities, as well as you can touch the extremities and see for the whether it is warm or very cold in texture. And you can also see the neurovascular assessment by checking by pricking assessment. Sensory neuron can be stimulated and you can identify whether the patient is having some sort of circulation compromise. Instruct the patient to remove the bandage at least once a day so that it will avoid the skin breakdown. And we have to tell the patients of early signs and symptoms whenever they feel numbness, tingling, or maybe pain or bluish or pale skin, which are the signs of neurovascular compromise. So these are the common questions that can arise from the university. That is, write the techniques of hand and fist bandage, or what are the do's and don'ts as a nurse you assess for a patient for ankle and foot bandage. How do you apply the spica bandage? Can be the possible questions. So this is a 5-minute assessment. So which type of bandage is more suitable for making a sling? So in order to make a sling, you need to have a triangular bandage where you're going to use the upper extremity. And in case of an elastic or crepe bandage, commonly used to mainly reduce the swelling and provide comfort. So B is the answer. Tubular bandages are mainly used for cases such as any abdominal injuries. So in case of like 1 marks, they can also ask roller bandages are available in various widths and wraps around the limb. Yes, true. And then triangular bandage can be used only as arm slings. No, you can use it even for emergency in sort of any sort of wrist or maybe other thing. So these are the common references which I have. So thank you so much for patient listening. Yet stay tuned to look on to different bandages and witness the practical session in the few further classes. Any doubts or any queries, please feel free to ping up in the comment box. Thank you.